I just wanted to welcome everyone on the line today to this month's Encompass Mental Health Awareness and Communication Series webinar. My name is Michelle. I'm on the Encompass leadership team here at Dalton Associates. So thank you all for taking the time to join us today. Appreciate it. A few months ago, we offered a session that introduced the Encompass program as a whole. So that was actually our first webinar that we did. And so in today's session, we'll be building on that with our guest panel. This will be an opportunity to further explore the mental health supports available to you and your colleagues through the Encompass program, also to gain further comfort in seeking support and to feel confident in those who are on our team. Before I get started, I'll just review a couple of housekeeping items for those of you who these will be repetition, but firstly, in order to enable anonymous participation, we've purposely disabled everyone's cameras and microphones for the session except for our panelists, and these will remain off throughout the session. Secondly, we absolutely welcome and encourage questions today, so please write your questions in the Q&A feature, which you should find at the bottom menu of the webinar. We want to assure you that anything you write in the Q&A can only be read by myself and our panelists on the line today. So we'll read them out without identifying who the individual is who've asked the question. And if you choose, when you start typing your question, you can actually choose anonymous, and that will disable us from seeing who's asked the question as well. Third, we will be recording the first section until we get into the questions. So this is the part of this session when our panelists will talk about their role, introductions, what services they offer, etc. So when we start taking questions again, we will turn the recording off and I'll alert you to when this happens. And then lastly, we will not be taking a break during this hour. So if you have to step away, rest assured, we will get the Encompass webinar recording up on the site as soon as possible. All right. So just before we get into introductions, just wanted to share the reason why we thought a panel discussion that gets more in depth with the program was so important to share. So we know that understanding and navigating the mental health landscape can be confusing, it can be overwhelming, it can even be intimidating. For example, you or someone you know might be saying, I know I want help, but what service is it that I need? Do I need counseling? Does my whole family need counseling? Do I need a social worker? Why not a psychologist? What's a psychotherapist? What's the difference? What kind of residential treatment centers are out there, et cetera. And we know that this can be really overwhelming and confusing, and it can also be really difficult to make that first call. What is the care manager going to ask me? Will I be able to speak to someone right away? How long is it going to take? When can I, get the support that I'm asking for? So our hope today is that you'll leave here with a better understanding of how the Encompass program can help you, a greater awareness of the span of treatment provided by the mental health providers with varied designations, and that you're going to feel comfortable reaching out to us when needed, knowing that you're in good hands. So again, thank you for joining us. Encompass is really meant to be a very integrated, comprehensive wraparound model of mental health and wellness support. So today we have a social worker, a care manager, and our psychiatrist here from the Encompass program to introduce themselves, to talk a bit about the services that they offer in their role, and also what to expect. So I'm going to turn it over to Carl, the first of our three panelists, just to introduce himself, and then we'll go to Kaylee and Dr. Rakesh Jetley from there.
Thanks, Michelle, and good morning, everyone. And thanks for joining on this much needed rainy day, I'll say, for at least where I'm located. I'm currently in my home office above my garage, which I've sort of turned into so I can be somewhat private from my three little kids here during, and so anybody that's trying to manage having the kids at home as well as your daily work and responsibilities, my thoughts are with everybody today. So, so I'm a social worker by training. I operate Dalton Associates as a CEO. We're a family-run business. My dad's a psychologist, Dr. Dan Dalton. He's semi-retired. still operate sort of somewhat as the president of our company, and certainly in some leadership, and he does some clinical supervision as well. And social workers really, although our practice is initially built around psychology, the social worker influence on this is really about program development. And this is where our training really comes into place around cultural diversity. And that can be any culture, unique cultures, culturally specific, as well as a wraparound care model. So what does an integrated approach really look like? So for the last maybe decade or so, social work has been really focused on anti-oppressive practices, inclusion, as well as integrated services. So what does a multidisciplinary service look like? How do you organize it? What's the workflows from everywhere from the initial care management interaction all the way through to maintaining some of the healing that you've gained through the practice. So we really want to follow people all the way right from the entry point to post-treatment and then continue it on where we can. So I think that's where, you know, as a social worker, we get the most excited about this type of work, is because we know that it needs to be specific. We know we needs to have the voice of the users, and we know that there needs to be an intervention at every level. So every time you interact with Encompass, there should be a level of intervention happening. There should be a concierge, there should be a lot of empathy, there should be a lot of care, and then a lot of follow-up and, you know, the legwork that comes with that until you get into a treatment of yours or your family member's choice, and you know, can start on a way to do some healing. So I'll maybe talk a little bit about some of the, maybe just on the next slide, Michelle, or are we going to do intros?
Can we just do, yeah, let's just do some intros first, and then
Okay.
yeah, we can get into that for sure. So next up is Kaylee Smith.
All right, good morning, everybody. So my name is Kaylee, and I am one of the care managers working on the Encompas team. So I would be one of the people that you are initially in contact with when you either call in for services, or if you're emailing in inquiring about services. And much like the rest of the care management team, I have a background working in mental health care. So that's a specialist degree in mental health from the University of Toronto, and then a postgraduate certification in crisis and trauma interventions. So, you know, the care management team and myself included are coming from trauma, all of the aspects of care that Carl had just mentioned. And then I'm also finishing my master's degree at Yorkville, looking to become a registered psychotherapist as well.
Thanks, Kaylee. And on to Dr. Rakesh Jetley.
Hey everybody, nice to meet everybody virtually at least. I'm Rakesh Jetley. I'm a psychiatrist. Happy to be part of the team. I've just left the Canadian Armed Forces after 31 years of service, sort of as a primary care family physician, but then the last 20 years as a psychiatrist, and was the chief psychiatrist. So a lot of experience in post-traumatic stress disorder, helped establish some of the programs that we've had and some of the involvement with research. It's really good to be part of this group because I've always practiced team-based care, and often you see psychiatrists and psychologists separate in sort of their own silos. So I really appreciate the team-based because everybody in the team can contribute. We can talk a little bit later depending on the question. Sometimes people mix up psychiatrist versus psychologist. And a psychiatrist is a specialist physician. So just like if you're struggling with knee pain or headaches and your family doc sends you to a specialist neurologist or orthopedic surgeon, a psychiatrist in the same way. So we take more of a biological approach. We can help manage and advise with medications, not just the psychotherapy, although we clearly know that both are important aspects of it. So let's just stop there and give people as much time for questions as we can.
That's awesome. Thank you, Dr. Jetley. So just building on that vision that actually all three of you shared, but Carl introduced, I just wanted to, Carl, I want to give you some time to expand a little bit further and discuss some of the challenges that led to the development of the Encompass program and kind of that vision. So here you go.
So I think we're in the designing of a program like this, which really, it came from a series of roundtable discussions, reports, provincial work done, a lot of, an extraordinary amount of work done by the association, and where members' voices were not only, presented, but also recorded and documented. So we know that there's a significant amount of personal and family stress just within the role within the OPPA. So as a member, as a police officer, as a civilian, supporting the service, we know that there's a significant amount of personal and family stress. That just comes to it about, for us, it's been about attention to detail, the amount of scrutiny that you're under, and the amount of details that have to be captured there. And I think just at the end of the day, the subject matter you're dealing with, is most of the time not always a pleasant experience on behalf of the member. Out there in the world, as they're trying to protect us, there's not enough credit being given. We know that. When it comes to looking for help and how do we start to do this is, obviously we need to get mental health stigma. The more we can talk about it, and I think, COVID has given us an opportunity here where mental health tends to be at the forefront of all our minds. It's no longer sort of secondary or tertiary care. It's a primary need. We all know that. We know the more we talk about it, the more it becomes a part of our everyday language. It doesn't mean we have to share our deepest personal things with the person next to us on a park or even at work, but we know the more we talk about it, the more we recognize it as a true ailment or something that can hinder our performance and hinder our relationships and our ability to connect with others. Then we're already going to make huge leaps and bounds if we can just get at that stigma. And so when we designed this, we had a destigmatizing approach to it because we know the stigma is grand everywhere we look, really, throughout society, and perhaps particularly, although I think it's shifting within first responders culture. We know that it's a fragmented system. We know there's unclear avenues. We know there's competing interests for people to try to get your services, as Dr. Rakesh Jetley just said. The siloed, operating separately. Where do you go for what service? How do you know what service you need? How do you even, if you just start talking about some issues going on internally, whether it's feelings, thoughts, behaviors, as soon as you start talking about it, you get a new recognition of what that is or how much that's been impacting you. So there's a lot of unclarity, I guess, in general. And so if the avenues aren't clear to help, then it's that much more stressful. If you're trying to navigate a fragmented system while raising a family, while going to work every single day, and that job is under a huge amount of stress and scrutiny, we know that'll be it. It'd just be overwhelming, and people would just prefer not to reach out. So we know those things of siloed mental health services, stigma, a lot of personal and family stress due to the workplace and the lifestyle of working shift work, and then unclear avenues to ask for help. We know those have sort of built up, sometimes led to tragic consequences. So that's really where we wanted to build this, and where your association put out a request for proposals around something we'd like a really concierge wraparound service.
And so that really brings us to what that wraparound service is. So there really is a myriad of things that the Encompass program offers. And some of you may have seen a version of this diagram before, but it really captures the full scope of the program and how individualized it is for everyone who reaches out. No two people are the same, so no two plans of support through the Encompass program are the same. As you can see at the center is the member, and then that member is encircled by care management. That is Kaylee here. And then from there, navigation and access to a variety of supports and services, social work, psychotherapy, psychology, psychiatry, inpatient and outpatient treatment programs, crisis support, peer supports. We also have self-guided courses through the client portal. And that is very overwhelming. It's comprehensive, it's, it's wraparound, but it's also very overwhelming. So now is when we'll take some time to hear from the panelists in order to demystify some of their profession, some of their roles, some of the things that we're doing within the program. And so just to kind of start us off, a question for Kaylee as a care manager. I know we have a couple of slides, but can you take us through what to expect when someone calls into the Encompass program, what to expect from the care management team?
Yeah, absolutely. So when you're calling into Encompass, so we are 24-hour, 7-day-a-week support. So it doesn't matter what time you're calling, what day you're calling, you're getting a member of the care management team. And we all come from a mental health care background. So you're getting the same level of service no matter when you're calling in. The first thing that we make sure that we're relaying to you when you are calling or emailing in is that the issues that you're sharing are completely confidential. So we really take confidentiality and your safety and comfortability with the utmost respect, so that you feel comfortable with us helping be your advocate and your navigation through the mental health system and your mental health journey. So you're getting a completely empathetic approach from anyone that you're speaking with on the care management team. And we're really there to help game plan with you sort of what you need and help explain the different services we offer. So we really use sort of a tailored structure, I would say, when you're first calling in, so that everyone's getting the same level of care and understanding. And then from there, we can sort of determine your needs based on how much you feel comfortable sharing, what's going on in your life, how much support or access you want from Encompass. And then we just sort of take it step by step alongside with you. So we are meant to be a go-to resource when you have questions about what kind of therapist options are out there, who the therapists on our Encompass website are, different support options, whether it be inpatient or outpatient. We can explain to you really anything you need in terms of services. And we're also there to be a voice for you to advocate your needs, as well as just a listening ear. So if you have used mental health services before and you sort of have an idea of what you're looking for, what kind of therapy options would be, sort of working for you, I'm there to help facilitate that. If you've never used mental health supports, I can step in and sort of help you choose and navigate what might be best for you, explain to you what to expect during a first counseling appointment, or what to expect during a referral process to one of our inpatient or outpatient programs. Really answer any questions that you might have around, getting a diagnosis or looking into medications. It's really such a tailorized program that it's genuinely whatever you and your family need. And this, this sort of relationship and care doesn't extend to just your intake as well. Like, this is a sort of a lifetime relationship if that's what you're looking for. So if that means that you want myself or one of the other care managers to be checking in with you quite regularly for extended extensive talks, we're there to do that. If you want to limit you know a relationship working with a care manager after you've been set up with services, we're there to do that as well. It genuinely comes down to whatever you are looking for and what you need at the time. We're there to step in and really implement that team-based approach that Dr. Jetley referenced earlier, and really work as a whole model together to make sure that you're getting supports when you need them, as you need them.
Thanks so much, Kaylee. Carl and Dr. Jetley, could you help? I'm going to open it up for questions in a second, and we'll turn off the recording in a minute. But could you help the participants really understand some of the nuances between social work, psychotherapy, psychology, psychiatry? I mean, it's a loaded question. I know there's a lot of differences, but also, we offer kind of very comprehensive services, but sometimes people just don't know the differences between those. And so I'm just looking to you to explain some of those differences and how the different professions might be able to help. And Dr. Jetley, you actually touched on it a little bit already.
Yeah, no, I'm happy to kick off with that. And I think it's a really important thing for people to understand that it's like any team. I mean, if people are Maple Leaf fans, last night we saw the third line actually helped contribute to the victory, right? So sometimes your starting lineup. So it's not better or worse, it's an entire team contribution. Everybody brings something different. And it starts with education, training, and perspective. And I think that's what, as a psychiatrist, as a physician, we trained in a disease model. We start with anatomy, physiology, dissecting human bodies, understanding what's happening in the body. And so it tends to bias us towards the individual disease, fix the disease, get in there. We do have a biological bias, of course, in psychiatry. The psychotherapies become important. But I think what happens is then you have professions like social work that come from a different perspective altogether. And they bring in the fact that we now know that these illnesses, these diseases affect the whole system. They affect the family, and you really can't sort of put somebody in a bubble and just treat that individual. You have to sort of be able to understand what's happening in the family. In the military, we realized it affects the children, it affects the spouses, and so our approaches have to be broader than that. So I think from a psychiatrist perspective, if I was sort of isolate and forget the 20 years that I've learned from my colleagues and other professionals, is we come in with, here's a disease, let's make that clear diagnosis, let's have the best biological, psychological, and social treatments come in. Psychiatrists have the understanding of how your high blood pressure and heart disease also interfere. The chronic pain meds that you're on may interfere with your antidepressants, and we bring that sort of biological basis to it. But the psychiatrists that are part of our team, my colleagues as well, really have come from this team-based approach where the respect for the psychotherapy, safety, confidentiality, family approach is all there. I think psychologists are sort of our cousins, and over the last couple of hundred years, psychology and psychiatry was sort of close, sometimes overlapped. The main restriction is that psychologists do not go to medical school, so they're not MDs, they're not physicians. They're usually more master's level or PhDs that really studied the human mind, human behavior. Their depth is often in either assessment, treatment, or both. And many of my colleagues that conduct research all over the world can be psychiatrists or psychologists, sorry. And I think the psychologist, the unique aspect of psychology, which is maybe the unique aspect of psychiatry, is the medication along with family docs. Psychologists are able to do really in-depth assessments with psychometrics. Sometimes people have those questionnaires. Psychiatrists tend to do those less. And so in depth, so if there's trouble in somebody responding to the usual therapy, a psychologist is able to do a deeper dive in terms of diagnostic clarification, where one's personality could get involved. Social work, of course, I'll let Carl speak to more, but again, the beauty of social work is that the training in social work, of course, can be quite broad, But what they brought to the teams that I've worked with is they brought in more of a community family perspective. So they're absolutely fantastic individual therapists as well, but their lens is different. And so in many ways, just like the image that people have of, the elephant and the blind men around the elephant, each person is seeing a different perspective. In many ways, that's the way the team can work. So our training brings us a different perspective, and as long as we're open to learn from each other, we can, our skills, where they overlap, but they often are unique, can sort of help clients in the best way possible. So Carl, I don't know if you have anything to add to that, but please.
I don't too much, I would just to speak to social workers and psychotherapists, I think our social workers are probably, if I'm honest, are a bit guilty of an identity crisis, because they've often worked for the, for the province and in the public sector for so many years, and they operate things like child welfare and some addiction programming, things like that, and social workers have sort of been sort of around that. And I think, what I hope is the emergence of social workers is of this integrated care, that really being focused on a systems perspective, recognizing we don't do diagnosis, we don't make recommendations on medical. Now, we can, I'm clinically trained. I got all of that training though from people like working with people like Dr. Jetley, MD, psychologists. Working in a team approach, I became clinically trained, taking professional development, learning how to do therapy. Being a good therapist doesn't depend on your degree and your training necessarily. You need to have it, but that's not necessarily what makes a good therapist. I think clinically social workers are there and can be great therapists. But I think if we were to look at it sort of from where's our work is really in sort of anti-oppression, systemic work, bringing everyone together, seeing it through a lens of family and systems, and how do these all integrate so we can, and I think a really client-centered approach, and sort of seeing and listening to that voice of the client or the service user, and having that as a strong voice in the treatment plan as well. Is there a key team member there? We have to be able to see the world through the service user's eyes. And I think to the same degree, psychotherapists are really specifically trained and do a ton of hours just in training education around that one-to-one or family counseling, and then continue on with professional development from there. So I think you'll find, social workers and psychotherapists are often in the same space on that clinical side or in private practice. And I think you'll see that, in throughout Encompas as well. You'll see them across the board, social workers and psychotherapists fulfilling similar roles, but probably with, as Dr. Jetley said, with a bit of a different lens through that. And that's where I think Kaylee's role comes in that care management piece, which is really why I call that initial care management. I call that phase one of an intervention. That's really where Kaylee and her team are listening and hearing your voice in it, and trying to make sure they can say, look, where does this perspective get? So that we aren't the directors, but we're collaborators with the members who are seeking service. And that's really how it is, a collaborative piece to guide, saying, look, and then there'll be some clear indicators of saying, let's get a psychologist involved. Let's get a psychiatrist involved right from day one. Sometimes that comes later. Sometimes a social worker will be brought in after the psychologist is already in, and we'll work in teams. So I think that's sort of the level of care that we want to bring, because there's too many nuances out there to not work as a team, to rely this on one individual with one type of training, would obviously have gaps there.